Hello, my name is Evelyn Erin. So what is asthma? Asthma, commonly referred to as a bronchial asthma, is a lung disease. It is a chronic, continuing condition, so it does not resolve and require ongoing medical care. Asthma can occur in early age, which is known as childhood onset asthma. The major risk factor for this type of asthma is atopy, lower lung function, and respiratory tract infection. It can also develop later in life, which is known as late onset asthma. It is more severe and less associated with allergy. Generally, upon exposure to allergen, type 2 cytokines are produced by allergen-specific T helper 2 cells. This then gradually shows the hallmark features, which are eosinophilia, mucus hyperproduction, production of immunoglobulin E, and bronchial hyperresponsiveness (BHR). Asthma can be diagnosed by using 3 tests, which are FeNO test, a machine which measures the level of nitric oxide in breath, a spirometry, a machine which is to measure how fast an exhalation and air volume in lung, and lastly, peak flow test.
Asthma symptoms vary from person to person. People may have infrequent asthma attacks, have symptoms at only at certain times such as when exercising, or have symptoms at all the time. The asthma signs and symptoms include low peak expiratory flow readings when using peak flow meter, pale skin or having bluish lips or fingernails that caused by shortage of oxygen in the blood, having trouble walking or talking due to the shortness of breath, and lastly, chest tightness or coughing or wheezing.
Now I'm going to explain what triggers asthma. Asthma occurs in response towards the triggers. The common triggers include allergens such as dust mite, pollens, and animal weather. Apart from that, irritants in the air such as the perfume, fumes, and also pollution. Changing the weather can also trigger asthma during the cold weather and also during the windy day. Doing a physical activity such as intense exercise can also trigger asthma. Lastly, medicines, for example, inflammatory painkillers can like those aspirin and ibuprofen can trigger asthma. Now I'm going to explain about the pathophysiology of asthma. This asthma is being initiated or triggered by triggers in the environment such as allergens like the pollens or the dust mites. Then these allergens are being phagocytes, proctodendritic cell, which act as the antigen presenting cell or known as APC. This APC then presents its allergens on the MHC class 2, which is the major histocompatibility class 2, and being detected by helper T cell 2. The T helper 2 lymphocytes produce a series of cytokines, includes the interleukin 4, interleukin 5, and also interleukin 13. In the early phase, interleukin 4 and interleukin 13 stimulates the production of IgE antibody, which is secreted by the plasma cell. The IgE antibody then coat the surface of the mast cells and also the eosinophils. This allergen then bind to the allergen-specific IgE antibodies on the surface of the mast cells. After the binding, the mast cells then degranulated, and it releases its inflammatory mediators such as the histamine, prostaglandins, and also the leukotrienes. These pro-inflammatory mediators cause the asthma reaction. This is known as a hypersensitivity type 1, as it involves an immediate reaction. As a result, this causing the contraction of smooth muscle layer, which is known as bronchospasm, and production of mucus or also edema. If the asthma being poorly controlled over years, it causes multiple inflammatory cells to continue in the inflammatory process. The long-term remodeling of area cause it to be irreversible, and this will result in increased inflammatory production and causing the smooth muscle hypertrophy.
There are so many potential factors that can lead to an asthma attack, and preventing can be quite challenging. However, here are some tips on how to avoid asthma attacks. First, keep away from chemical and products that have earlier cause of breathing problems. If you have breathing problems when you're near some animals like cats, you should not get close to them, or you can just simply wear a mask. Second, keep away from allergens such as dust or mold. You can use air filtration system to get rid from the allergens, because according to the American Society of Heating, Refrigerating and Air Conditioning Engineers, the air filtration system can clear the air for at least 99.97% of pollutants. Thirdly, the doctor usually offers immunotherapy for asthma in the form of allergy shots. These allergy shots can help to treat asthma by gradually reducing your immune system response to certain allergy triggers. Immunotherapy involves getting regular injection of a tiny amount of the allergens that trigger your symptoms. And lastly, take a preventive medication as the doctor prescribes. Asthma medication usually falls into 2 categories, which the first one is the type of medication that you take on regular basis to prevent attacks, and the other type is for quick relief. Asthma medication may come in the form of an inhaler, a tablet, a liquid, or a shot.